blood tests are among the most common medical checkups ordered for seniors. They can provide valuable insights into cholesterol levels, blood sugar, kidney function, and more. However, when blood work is ordered too frequently or in unnecessarily large panels, it can create problems rather than solutions. For elderly patients, excessive blood testing increases the risk of false positives, unnecessary treatments, and emotional stress, while offering limited benefit. One of the main concerns is the false positive effect. As people age, the body naturally undergoes changes that may look abnormal on a lab report but are not actually dangerous. For example, mild changes in kidney function or liver enzymes can be a normal part of aging. Yet when doctors see these results flagged as out of range, they may suspect disease and order additional tests. This cascade of follow-ups can lead to more invasive procedures, medications, or even hospital stays, all of which may not be truly necessary. Another issue is that excessive blood work can contribute to overdiagnosis. Sometimes, lab results reveal minor imbalances or conditions that would never have impacted the senior's health or quality of life. Instead of offering reassurance, these findings can trigger unnecessary prescriptions, frequent monitoring, and lifestyle restrictions. In some cases, new medications are prescribed based on marginal results, which may cause side effects such as dizziness, weakness, or digestive problems outweighing any potential benefit. Frequent blood draws themselves can also be stressful. While the procedure is usually safe, repeated needle pricks can cause bruising, soreness, or anxiety, especially for older adults with fragile veins or thinner skin. Seniors on blood-thinning medications are particularly vulnerable to prolonged bleeding or hematomas from frequent blood tests. For those with mobility issues, the physical act of traveling to a clinic for repeated tests can be exhausting and disruptive. The psychological burden of excessive blood work is another important factor. Seniors may become overly focused on numbers rather than how they feel. When results are slightly abnormal, patients can develop unnecessary worry, and when doctors reassure them that the changes are minor, this constant concern about lab values can overshadow the enjoyment of daily life and contribute to depression or health anxiety. Financial costs also cannot be ignored. Large blood panels, when not covered by insurance, can be expensive. For seniors on fixed incomes, repeated charges for unnecessary lab work may cause strain. Some clinics promote executive health packages or full blood panels as preventive care, but these often include tests with little to no benefit for elderly patients. Instead of relying on blanket or routine panels, medical experts recommend personalized testing, focusing only on lab work that is directly relevant to the senior's medical history, symptoms, and ongoing treatments. For example, a senior with diabetes may benefit from regular blood sugar checks, but may not need frequent tests for rare conditions. Similarly, someone with stable blood pressure and cholesterol may not require repeated full panel testing every few months. Overdiagnosis is one of the biggest hidden risks in modern healthcare, especially for seniors. It occurs when medical tests detect conditions that look abnormal but would never actually cause symptoms or shorten a person's life. While catching diseases early is often seen as beneficial, overdiagnosis can trap elderly patients in a cycle of unnecessary treatments, medications, and hospital visits, leading to side effects that reduce quality of life rather than improve it. The problem begins with excessive screening and testing. As people age, doctors may recommend a wide range of checkup scans, blood work, biopsies, and monitoring tests. These can detect small growths, cysts, or lab abnormalities that appear concerning but are not truly harmful. For example, prostate cancer in elderly men or thyroid nodules in older women often grow so slowly that they would never affect health. Yet once detected, the instinct to treat them is strong, even if treatment offers little or no benefit. The next stage is the cascade of treatments. An abnormal test result may lead to medications, surgeries, or therapies. For seniors, this can be risky because older bodies are less resilient and more sensitive to medical interventions. For instance, a senior diagnosed with mild thyroid issues might be prescribed medication that disrupts heart rhythm, or someone treated for early prostate cancer might suffer incontinence or sexual dysfunction. These side effects can be more damaging than the original. Slow-growing condition. Polypharmacy, taking multiple medications, is a common consequence of overdiagnosis. Many seniors already juggle drugs for blood pressure, cholesterol, arthritis, and other age-related conditions. Adding more prescriptions based on minor or questionable diagnoses can lead to dangerous drug interactions. Side effects such as dizziness, confusion, falls, or digestive issues often result from this overload of unnecessary medication. The emotional burden of overdiagnosis is equally harmful. Being told that you have a disease can create anxiety and fear, even when the condition is unlikely to cause harm. Seniors may live in constant worry, scheduling frequent doctor visits, follow-up scans, and lab tests. This cycle fosters dependency on the healthcare system and robs them of peace of mind. Financial strain is another factor. Unnecessary treatments can be extremely costly, from expensive prescription drugs to surgeries and hospital stays. Insurance may not fully cover all expenses, leaving seniors or their families struggling to pay for interventions that may not truly improve health. To address overdiagnosis, many experts now emphasize right care, not more care. This means tailoring healthcare to the individual, focusing on quality of life rather than aggressively treating every abnormal test result. In older adults, especially those with multiple health conditions, doctors may recommend watchful waiting or symptom management instead of immediate treatment. For example, monitoring a small, slow-growing tumor may be safer than surgery. While medical tests are designed to protect health, they often bring with them an overlooked consequence: emotional stress and anxiety. For seniors, this psychological burden can sometimes be as harmful as the physical risks of invasive procedures. Excessive testing may provide reassurance in some cases, but more often, it creates cycles of fear, worry, and confusion that affect both mental and physical well-being. The stress usually begins with the anticipation of the test itself. Seniors often feel anxious before medical appointments, worrying about the preparation, the discomfort of the procedure, or the possibility of bad news. For example, preparing for a colonoscopy or waiting through a lengthy imaging session can trigger restlessness, nervousness, and sleepless nights. Seniors who already live with conditions like hypertension or heart disease may find that this pre-test anxiety worsens their symptoms. Once the test is complete, another wave of worry sets in waiting for results. Even routine blood work or X-rays can take days to return, and the uncertainty during this period often causes older adults to imagine the worst. This mental strain can disrupt daily life, leading to insomnia, loss of appetite, or even depression. The stress can also weaken the immune system and raise blood pressure, ironically, creating health issues where none existed before. A particularly damaging aspect of overtesting is the risk of false positives and incidental findings. These occur when test results show minor abnormalities that are not dangerous but appear suspicious. For example, a harmless cyst or a mild lab irregularity might be flagged as abnormal, leading the patient to believe something is seriously wrong, even when follow-up tests later prove there is no threat. The emotional impact of believing you might be ill can linger for months or years. Another factor is the loss of trust in one's own body. When seniors undergo frequent medical tests, they may start to feel as though their bodies are failing, even if the results are minor or irrelevant. This mindset can reduce self-confidence, discourage physical activity, and make them more dependent on doctors rather than feeling in control of their own health. Over time, this can erode overall independence and quality of life. The financial costs of repeated tests also contribute to stress. Seniors on fixed incomes may worry about paying for procedures that are not fully covered by insurance. The pressure of medical bills adds another layer of anxiety, often leading to feelings of helplessness or resentment toward the healthcare system. To reduce emotional stress, experts recommend personalized testing rather than blanket screening. Seniors should only undergo tests that are medically necessary, based on symptoms, personal risk factors, and their doctor's advice. In addition, doctors and caregivers should focus on clear communication explaining why a test is needed, what the risks are, and what the results might mean. This transparency helps seniors feel more informed and less fearful. When it comes to healthcare for seniors, the old saying "more is better" does not always apply. In fact, many older adults face unnecessary risks when subjected to one-size medical screenings that do not take into account their individual health needs, history, or life expectancy. Personalized checkups, tailored specifically to each person, are far more effective and safer than blanket screening programs that treat every senior the same. The problem with generic screening guidelines is that they are often designed for the general population without fully considering the unique. Full body scans may sound reassuring, especially for older adults who worry about hidden health problems, but the reality is that these tests can sometimes cause more harm than good. While the idea of scanning the body from head to toe to catch diseases early might seem beneficial, seniors need to understand the risks that come with unnecessary scans, particularly CT scans and PET scans, which use radiation and advanced imaging. One of the biggest dangers lies in radiation exposure. CT scans expose the body to levels of radiation far higher than a regular For younger people, the body might tolerate such exposure more easily, but in older adults whose cells are already more vulnerable, repeated exposure can increase the chances of complications, including potential cancer risks. This risk may be low, but when scans are performed without clear medical necessity, it becomes an avoidable hazard. Another serious issue is the risk of false positives. A full body scan may reveal spots, shadows, or small growths that look suspicious but are actually harmless. In seniors, these are often age-related changes that do not pose any real health threat. However, once something unusual shows up, doctors may recommend further invasive tests, such as biopsies or surgeries. These follow-up procedures carry their own risks, including infection, bleeding, and long recovery times, something older bodies may struggle with. Thus, an unnecessary scan can trigger a chain of unnecessary medical interventions that bring stress and harm. Financial strain is also an important factor. Full body scans are often not covered by insurance when done without a medical reason. Many seniors live on fixed incomes, and spending large amounts on tests that don't improve health outcomes can be wasteful and stressful. Worse, some private facilities promote these scans as preventive health checks, preying on the fear of aging, while offering little real benefit in return. Additionally, psychological stress should not be overlooked. When scans show incidental findings, which is very common, seniors can become anxious about their health. This worry sometimes persists for years, even when follow-up tests prove nothing is wrong. Constant fear about one's health can reduce quality of life, disturb sleep, and even worsen conditions like high blood pressure. Experts generally recommend that seniors focus on targeted screening instead of full-body scans. That means getting tested only for conditions they are at real risk for, based on their age, family history, and current symptoms. For example, regular blood pressure checks, cholesterol monitoring, or bone density tests may be far more valuable and safer than exposing the body to unnecessary radiation. In short, unnecessary full-body scans in seniors can create more problems than they solve, causing radiation risks, false positives, invasive procedures, financial strain, and emotional stress. The best approach is to have an open discussion with a trusted doctor about which checkups are truly needed. Cardiac stress tests are often prescribed to evaluate how the heart responds to physical exertion. They are useful in certain situations, especially when a patient shows clear signs of heart disease or chest pain. However, for many seniors, repeated or routine stress tests without strong medical reasons can be more harmful than beneficial. Stress tests typically involves walking on a treadmill or riding a stationary bike while the heart is monitored through an electrocardiogram (ECG) imaging, or sometimes even injections of radioactive tracers. For younger and relatively healthy individuals, the test is usually safe. But for older adults, the physical strain combined with existing health conditions can lead to risks that outweigh the benefits. One major concern is the physical strain on the heart. Seniors with arthritis, mobility issues, or reduced stamina may struggle to perform the exercise required during the test. This can lead to falls, muscle injuries, or even acute cardiac events in rare cases. For frail, elderly individuals, just attempting to complete the test can place unnecessary stress on the body. Another issue is the risk of false positives. Stress tests are not perfect. In older adults, the test often picks up irregularities that may not actually indicate dangerous heart disease. For example, age-related changes in heart rhythm or previous minor heart damage may trigger abnormal readings. These false alarms frequently lead to further procedures such as angiograms, catheterizations, or even stent placements. While these may sound protective, they carry serious risks, including bleeding, infection, and complications from anesthesia that may not improve long-term outcomes for seniors. The problem doesn't end there. False positives can also cause emotional stress and anxiety. Being told that your test result looks abnormal can weigh heavily on seniors, even when later results show no serious issue. This anxiety can affect sleep, appetite, and overall quality of life. For many elderly patients, the emotional toll of unnecessary worry can be as damaging as the physical risks. Financial strain also plays a role. Stress tests, particularly those involving imaging or radioactive tracers, can be expensive. Repeating them regularly without strong evidence of need adds unnecessary medical bills, especially troubling for seniors living on pensions or fixed incomes. Medical experts today advise that stress tests should only be used when symptoms suggest possible heart problems, for example, unexplained chest pain, shortness of breath, or irregular heartbeat. They are not meant as a routine checkup for every senior, especially those who already have stable heart conditions under control with medication and lifestyle changes. Instead of repeated stress tests, seniors may benefit more from simpler, non-invasive measures such as regular blood pressure checks, cholesterol monitoring, echocardiograms when appropriate, and lifestyle habits that support heart health like walking at a comfortable pace, maintaining a balanced diet, and avoiding smoking. These preventive measures often provide better outcomes than repeatedly putting the heart through artificial stress. Colonoscopies are widely considered the gold standard for detecting colon cancer and other gastrointestinal problems. They can indeed be life-saving when performed at the right age and for the right reasons. However, for seniors, especially those over 75 or with significant health conditions, the risks of colonoscopy often outweigh the benefits. This is why many medical guidelines now recommend caution when suggesting these procedures for older adults. A colonoscopy involves inserting a flexible tube with a camera into the colon to examine the lining for polyps, tumors, or other abnormalities. While this test is invaluable for early detection of colon cancer, the procedure itself carries risks that become increasingly dangerous with age. One of the most significant concerns is the risk of complications during and after the procedure. Older adults tend to have more fragile intestinal walls, which raises the risk of perforation, a tear in the colon. Even though this complication is rare, it can be life-threatening and may require emergency surgery. Additionally, bleeding can occur after polyps are removed, and seniors with thinner blood vessels or those on blood-thinning medications face an even greater risk. Another hidden danger is related to the sedation or anesthesia required for the procedure. Seniors often metabolize these medications differently, making them more susceptible to side effects such as confusion, low blood pressure, or prolonged drowsiness. In some cases, sedation can trigger breathing problems or heart complications. In patients with pre-existing conditions, the recovery from anesthesia can also be longer and more stressful for older bodies, sometimes leading to hospitalizations. Beyond the procedure itself, the preparation for colonoscopy poses its own set of challenges. Patients must undergo bowel cleansing, which usually involves drinking large volumes of laxatives. This can cause dehydration, electrolyte imbalances, and kidney stress, serious issues for elderly individuals, especially those with heart or kidney disease. Some seniors may even faint or become weak during the preparation stage, which can result in falls or hospital visits. Another problem with colonoscopies in seniors is overdiagnosis. Many small polyps detected in elderly patients grow so slowly that they are unlikely to cause harm within their remaining lifespan. Yet, once discovered, doctors often feel compelled to remove them, exposing the patient to unnecessary risks. This is especially troubling when the procedure does not significantly improve survival or quality of life in someone with limited life expectancy. Financial and emotional costs also come into play. Colonoscopies are expensive procedures, and repeated testing, when not truly necessary, adds financial strain on seniors and their families. Moreover, the process itself can create significant anxiety, from worrying about the preparation to stressing over the results. For these reasons, medical organizations such as the U.S. Preventive Services Task Force recommend discontinuing routine colonoscopies after age 75 or when life expectancy is limited. Instead, less invasive options such as stool-based tests FIT or FOBT can be safer and still provide useful screening information without the risks associated with invasive procedures. In summary, while colonoscopies remain an important diagnostic tool, their benefits decline, and risks increase sharply after a certain age. Seniors should not feel pressured to undergo routine colonoscopies if they are beyond the recommended age range or have other health priorities. Biopsies are medical procedures where a small piece of tissue is removed for further examination under a microscope.